So next we'll start with CNS pathology. So under CNS, we'll be dealing with meningitis, then the infections which cause encephalitis, then demyelinating disorders, then neurodegenerative diseases, then various CNS tumors and some miscellaneous topics. So let's start with meningitis. So meningitis can be infectious causes caused due to bacterial, viral, fungal or tubercular infections. So on this, we'll have to discriminate what is the cause based on the CSF findings. So the clinical history will be given like that of projectile vomiting with history of high grade fever, neck pain, and then they'll give the CSF findings. So then in the options, you'll have to find what is the causative agent. Okay. So let's see what are the characteristic features of bacterial, tubercular, viral and fungal meningitis. So normal CSF color will be clear with the protein component of 15 to 40 milligram per deciliter, and sugars will be 50 to 80 milligram per deciliter, and some amount of chloride will be present, and the normal cellularity will be 0 to 5 cells per microliter, and that will be usually lymphocytes. However, in bacterial meningitis, you get a very turbid or a cloudy kind of CSF fluid. So here in bacterial, the CSF fluid is going to be cloudy, and in all of the infectious causes, the proteins will be elevated. But it is in bacterial meningitis that it is going to be elevated far ahead than the normal limits. So very much increased levels of protein levels will be seen in bacterial causes of meningitis. While sugars will be usually decreased by bacterial meningitis because the bacteria will consume the sugar. So the sugar levels of CSF will be decreased. So it is grossly decreased in bacterial, while in tubercular also it will be decreased but not that much. Then chloride levels will be decreased in bacterial, and since being a bacterial infection, obviously neutrophilic infiltrate will be there. So lots of neutrophils will be seen in CSF microscopic examination. So these are the classical features of bacterial meningitis. However, if they mention a cobweb kind of a coagulum on CSF on gross examination, then they are specifying to a tubercular etiology. And here again, the proteins will be elevated and sugars will be decreased, but to a lesser extent. And the chloride will be very much decreased in a tubercular infection. So this we must remember. So chloride levels are very much fallen during a tubercular meningitis. And the cells, tuberculous infection, we know it will be a chronic inflammation. So lymphocytic and monocytic kind of cells will be there elevated in the CSF. Then in a viral infection, here the very important thing to remember will be the viral CSF grossly will appear clear, normal, like a normal CSF it will appear, and here the sugar and the chloride levels are going to be normal, while protein levels will be slightly elevated. And on microscopic examination, here again you will see chronic inflammatory cells like lymphocytes and monocytes. So sugar and chlorides will be normal in viral meningitis. Then in fungal meningitis, again here it can be clear or a turbid kind of a fluid, while the protein will be elevated, sugar will be decreased and chloride will also be decreased. And here any fungal meningitis, it will again lead to a neutrophilic infiltrate more, and if it's a chronic inflammation, it will again lead to a lymphocytic infiltrate as well. So the major features you'll need to remember will be the viral, it is the sugar and the chlorides are normal. In TB, there will be a cobweb coagulum associated with very much decreased levels of chloride, while in bacterial, it will be a cloudy fluid with elevated levels of neutrophils, elevated very much high levels of proteins and very much decreased levels of sugar as well. Okay, so these things you must remember. So let's see some of the causative agents of meningitis. Usually in infants, if you see, the common causative agents for meningitis will be a group B streptococcus. So group B streptococcal infections can be there. Other than that, you can have E. coli infections or Listeria infections or even Haemophilus influenzae infections. While in some elderly children, you will have pneumococcal infections, then meningococcus infections, then enteroviral infections. So adults also, the same kind of infections will be there. Same pneumococcal, meningococcal, enterovirus. Apart from that, you can also have hepatitis simplex virus. So HSV infections can also be seen. So in elderly age group, again, it will come back to Listeria monocytogenes, then pneumococcal infections. Okay. So you will be reading about this in micro as well. So just remember, the organisms vary with the age group of the patient also.